welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and let's look at today's top headlines. NMC cannot trace MCI notice on Uniform Stipend issued 3 years ago, an RTI application states. While responding to an RTI application, the National Medical Commission has accepted that it could not trace any records regarding a public notice issued in 2019 dealing with the issue of stipend of MBBS interns. In this regard, it is stated that the previous records or files pertaining to the RTI application could not be traced despite all possible efforts. The NMC was quoted saying by the media while responding to an RTI application filed by an RTI activist, Dr. KV Babu. Dr. KV Babu had filed the RTI application in January this year, seeking to know the status of the public notice dated January 25, 2019, along with all the comments received, the discussions on the amendments along with the file notes. NEET MDS 2022, NBE opens selective edit window for candidates to rectify incorrect images. Through a recent notice, the National Board of Examinations has informed about the selective edit window for NEET MDS 2022. Some of the applicants for NEET MDS 2022 have failed to upload the images, uploaded photograph captured through webcam, signature or even a thumb impression in their application forms as per the image upload guidelines. They have also failed to rectify such incorrect images despite being given opportunities through final edit window as well as through individual emails sent at their registered email IDs. The NBE stated that all such candidates are being informed once again through emails to rectify the incorrect images in their application forms. They shall be able to rectify the incorrect images in their application form during a selective edit window starting from 20th April 10 a.m. onwards till 22nd April till 11:55 p.m. NBE extends deadline to apply for DNB, DrNB final theory examinations June 2022. Through a recent notice, the National Board of Examinations has informed about the extension of the last date to apply for DNB, DrNB final theory examinations to be conducted in June 2022. The National Board of Examinations in Medical Sciences shall conduct the DNB, DrNB final theory examinations of the session on 22nd, 23rd, 24th and 25th June 2022 at various examination centers across the country. Medical Dialogues had earlier reported that the last date for submission of thesis to NBEMS for the purpose of eligibility for DNB, DrNB final examinations in June 22 has been extended till 25th April 2022. The last date for submission of online applications for theory examination has accordingly been extended till 30th April 11:55 p.m. The application form for DNB or DrNB final examinations can be submitted online only. Prescribe generic medicines or face action, Chhattisgarh CM slams the government doctors. Chief Minister of Chhattisgarh Bhupesh Baghel announced that doctors in government hospitals in Chhattisgarh will face stringent action if they prescribed branded medicines instead of generic drugs to patients. Taking stock of the state government Shri Dhanvantri Generic Medical Store scheme while chairing a review meeting, Baghel expressed resentment over branded medicines being prescribed in government hospitals. Clause 1.5 of Indian Medical Council Professional Conduct, Etiquette and Ethics Regulations 2002 prescribes that every physician should prescribe drugs with generic names legibly and preferably in capital letters, and he or she shall ensure that there is a rational prescription and the use of the drug. Moreover, the state government, through its Shri Dhanvantri Generic Medical Store scheme, provides free generic medicines in all the public health facilities. Through this policy, the government of Chhattisgarh has made considerable progress in increasing access to generic medicines for patients in public health facilities. Under the Shri Dhanvantri Generic Medical Store scheme, as many as 84 generic medicine shops were opened across the state on the inaugural day of the scheme in 2021. Traditional medicine can help countries move towards universal health coverage, says a top WHO official. Traditional medicine systems can help countries in their mission to provide universal health coverage, World Health Organization Director General Dr. Tedros Ghebreyesus said here on Tuesday. Prime Minister Narendra Modi, Ghebreyesus and Mauritius Prime Minister Pravind Jagannath laid the foundation stone for the WHO Global Center for Traditional Medicine. The center will help countries harness the power of science to strengthen traditional medicine with a focus on evidence, data, sustainability, and innovation. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.